Did you figure out sound, or can I logged into the one. That's cool.
Yeah, you're right. It is.
I love that.
Hey. Hey, Mark.
Yes, ma'am.
The it has done quite well. Thank you for your guidance and advice.
Oh, good. Very
Yeah.
good.
When they're, yeah, it's amazing. So thank you.
You're home. Anything I can do to help?
I appreciate it.
So it is noon, and we are fortunate to have Tim DeWeese, the Director of Johnson County Mental Health, with us today. Tough time of year for a lot of us to cope with some of the changes and things going on in our world. But fortunately, we have so many positive things that we can look at too. And I know Tim's going to help us with some ideas of how we can enjoy the holidays that are upon us and a few little tips. And then we're going to have some time for questions at the end. So if you have a question, if you want to just type it into the chat, and then we can get with Tim, see if he has some more answers for us. With that, Tim, welcome. We really appreciate you being with the Northeast Johnson County Chamber today.
Well, I appreciate the offer to come and join you, and I know that I've been with you all before, so it's good to be back. And I'm glad to be able to share a few things today. I didn't do a presentation because I was hopeful that I could just share a few words, maybe offer a few suggestions, but then see specifically what you all had or wanted to know specifically, if there were specific things that you wanted to hear. So please let us know through the chat if there are specific questions. I do think, you know, this time of year is always difficult. It's difficult because we have less sunshine. It's difficult because of the cold weather and we're not able to get out as much. And then you put on top of it, we're experiencing this global pandemic that has engulfed the entire year of 2020, and we know it's going to go into 2021. So that just makes it even more difficult. And I think that, you know, over the past months, over the past several months, public health officials have provided us recommendations about the best way to reduce the spread of the virus and mitigate the health and economic and personal consequences of this pandemic. And those, of course, include wearing a mask, maintaining, and I'll be clear, maintaining physical distance, but being socially connected. So a lot of times we hear that we need to stay socially distanced, and I've really been trying to stress there's a difference there. We need to maintain physical distance from one another, but we need to stay socially connected. And there are ways that we can do that. And I've just been astounded by the number of people that have found different ways, the number of young people that have found different ways to maintain that physical distance, follow the guidance of public health professionals, but also be socially connected. Again, avoid large gatherings, wash your hands, and don't go to work sick, which seems to be the one that we always have to remind folks is if you're sick, stay at home. And we always say that, in particular in flu season. But for people, that's hard to do, especially when you feel that you need to get things done and all of this the stress that places upon us. As the infection rate continues to grow, though, in our community, and I think that it will be critical that we find ways to protect and enhance our own well-being and our community's mental health. And I think there are a few actionable steps, and I want to, there's, in my mind, there's 5. And I want to talk about those 5 actionable steps. And then we could even get a little more specific to what that means from a practical level. So the first actionable step is acknowledgement. And that is that it seems to be a very simple thing, but I have not met anyone over the course of my career that has overcome any barrier in their life or any trauma in their life and did not acknowledge that they had been impacted. So acknowledging that we are amidst a global pandemic and that it's having devastating health effects, economic effects, and personal effects on all of us, individually as well as our families across our community, is important for us to be able to do that so that we can then begin to acknowledge it and move forward. And so the first thing I think is acknowledging the impact that it's having on each one of us. And we also have to realize that that impact is different. What one person is experiencing is different than what another person's experience. And what one child or young person is experiencing is different. So I hear a lot about kids struggling in school, and absolutely that is an experience. There are also kids that are flourishing in this type of environment, and that's another experience. So we have to be careful about generalizing from one person's experience to another person's experience. The fact is we all have never been through this. We're all experiencing it in different ways, in addition to all of the things that are happening personally in our lives that are impacting us. And so being able to acknowledge that and validate that we're having these feelings is really an important step for us in moving forward. The second thing I think it's important to remember, and what I would say is an actionable step, is to talk about mindfulness and emotion regulation. And when I say mindfulness and emotional regulation, what I mean is that it allows us to be reflective versus being reactive. And when you are mindful of situations, when you are intentional and thoughtful, when you regulate your emotions, you're much more able to provide a little grace and kindness to one another, and a lot less. You have a lot less. What would I say? You're a lot less likely to be reactive to those situations. Again, the fact is that the fear and anxiety about the virus and what could happen and what is happening is overwhelming, and it can cause all kinds of emotional reactions. And in a world where we face so many things that we cannot control, the one thing that we can control is how we react to the situation and how we cope with the stress. How we cope is really important. It ensures that we find a healthy way to move forward. And if you cope with the stress in a healthy way, you not only improve things for yourself, but you improve things for the people that care about you. You make your community stronger, and it's really just kind of a win-win situation. I would also encourage people that there are some really good coping strategies and mechanisms, and there's a whole toolbox that we've created, and you can access that toolbox at our Johnson County Mental Health Center website. You go under Education and Outreach, and there is a little tag that says JCMHC Community Toolbox. And that toolbox can offer you all kinds of thoughts about how you can find healthy coping strategies. And I think that's really important in order for us to do that. But again, if we find healthy coping strategies, then we are really being mindful. We're regulating our emotions, and we're being intentional about how we respond to things as opposed to react. I think the third thing that we can do, and I think this fits well with the holiday season as well, is that we can share a narrative of hope. And that narrative of hope reminds us all that this is temporary. Yes, the world has changed in significant ways, and it's impacted us in some cases horrifically. But that it is a season, and that this change will not be forever. And I think it's important for us to realize that we have two narratives that we can model. And then it's up to each one of us to decide which one of those narratives we want to provide. Those two narratives, one is what I would refer to as victimhood, that because of all this, we have lost a lot that we've been entitled to, that we should be enraged or upset about the things that are out of our control, and that we're going to be forever scarred by the things that are happening currently. And that's one narrative that I think many people are choosing to provide. I think there's another narrative, and that is a narrative of empowerment. And that narrative of empowerment is about delayed gratification. It's about adaptation. It's about resilience. It's about grieving and moving on and finding new meaning and new coping skills. And one of the things that I have the pleasure of doing with, I get to work with young people that are connected with our Zero Reasons Why project, and quite frankly, they have provided so much. They've taught me a lot over the course of the last 3 years, and as we've worked to disrupt teen suicide within Johnson County. The fact is that the mental health conditions that are going on in our community that are impacting our kids, they've been going on, and I've been talking about them for a number of years. And in fact, prior to the pandemic, I was talking about how kids report being more lonely and more isolated than they ever have been in the past, even more than older adults. And a lot of that had to do with technology. A lot of that had to do, has to do with the way things were prior to the pandemic. But that has forced a lot of young people to look at things a little bit differently, to adapt. And I see the group of kids that, lost their graduation ceremony, and I've been able to, when they were seniors, and we went through that process last May, and I've talked with them as they are at school, and some of them have been at school and back, and then back to school, and the fact is that we as a community should take pride in the fact that we have some pretty darn resilient young people, that we've prepared them well to overcome whatever barriers they may exist. And I was really concerned that we might not be doing that well. But what I'm seeing within the pandemic is that we've done a pretty good job, and we need to continue to do that job. And that this actually provides us an opportunity when we start to talk about that narrative of hope. It really provides us an opportunity to even more develop that resilience, not only in ourselves and the people around us, but the young people that we come in contact with. So I think that this whole notion of sharing a narrative of hope, sharing a narrative of empowerment, is one that really influences your sphere of influence, the people that are around you. And the fact is that kids look to adults, kids look to their parents, and how we respond to situations is quite frankly how our kids are going to respond. And so I think that is very important for us to reflect on how we are acting and how we are providing the narrative, not only for our kids, but for everyone around us. The fourth thing is that of gratitude and helping others. There's a ton of research out there about the positive health benefits of being grateful and helping others. When you help someone else, it lifts your mood, it reframes your negative thoughts, and it lets us experience the healing power of human connection. And that is really what I'm talking about more than anything, is that when we talk about isolation and people reporting lonely, it's because we have lost the ability for us to connect in a human way. Technology, up until now, has really impacted that. And now we're forced, through technology, to find ways to do that. Beforehand, I would have been saying, we need to put down technology because it's been not healthy for us. In fact, it's led us away from getting together. Instead of going from office to another office and talking to a colleague, I would text them or message them or send them an email. And right now I can't do that. And actually I miss that. So the fact is that we have to find a way to make sure that we're reconnecting on a human-to-human level. I would talk a lot about Facebook and social media prior to the pandemic, that it was really not the best way to maintain a healthy human relationship. You know, most of social media, if not all, it's not, I would not call that authentic human relationships. And so what we have to find is ways to have authentic human relationships, and ways that we can do that utilizing technology. And I think one way to do that is through Zoom, things like that, where you can actually have face-to-face interaction, that you can actually see people and react to people. But when the pandemic, prior to the pandemic, these were things that I was already worried about. So the fact is that what we've been experiencing and the focus that has come onto mental health as a result of the pandemic is actually just making people aware of what's been going on for many years now. And so it's brought a lot of attention to what we need to do. So really being grateful and helping others is central. I think we need to make sure that we're checking in with one another, not just simply by asking how you are, but we need to ask each other about their mental health, about your mental health. How are you sleeping? How are you eating? Are you exercising? How are you coping with the stress? If someone says, well, I'm just drinking more. Obsessive drinking is not a coping strategy. And I couldn't express that more. Neither is using other substances. And so we really need to have those conversations and have that opportunity to have those conversations with one another. I would also encourage people to look for the opportunities that exist in the community. We have moved to providing adult mental health first aid virtually, and we have a couple of opportunities coming up within the first of the year, both for mental health first aid as well as youth mental health first aid, as well as a suicide prevention effort called Question, Persuade, and Refer, which is called QPR. And all of those training opportunities can also be found at our website. You can also contact our prevention services directly. And that number, I'm going to give you that number, 913-715-7880. And so, you know, we for years when I was growing up, we always talked about first aid and making sure that everybody had first aid, and you saw the big red cross. And so today, mental health first aid is just as important. It's a big blue cross, like the Red Cross of First Aid. And so I would encourage people to do that. The benefit of that is it gives people a lot of the information and some helpful strategies on how to respond when they're fearful that someone may be experiencing a mental health crisis. And then the final thing that I'll say before we get into a few more specifics about how you can improve coping strategies is really to make sure that you connect with professional help if you need to, or if people around you need to connect with professional help. You know, if the stress and anxiety get in the way of your daily activities several days in a row, and you start to experience those symptoms on a reoccurring process, and it begins to impact your ability to work or interact with others, then we really need to connect those individuals with professional help. The first place to start is you can contact the mental health center, and we can help walk through that process. You know, we operate a 24-hour crisis line. You don't have to be in crisis to call it. You can just call, and if you have someone you're concerned about, you can reach out and we can provide some information and kind of walk you through that process. If you have insurance, we can help people walk through that process of how they would look at their insurance and get that connected. And that 24-hour crisis line, that's 913-268-0156. And again, please, if you have any questions or any concerns about someone, seek professional help, and that's the first step that folks can do. You know, I don't believe that that we've seen the worst of the pandemic. I think we have a lot of hope with the vaccine coming out, but I think we'll continue as we move through the holiday season and through the winter, that we'll see more people struggle with their mental health. I think we'll actually see more tragic deaths, either by COVID or unfortunately deaths by suicide. But I think that we can really do a lot to be able to help support one another if we follow those 5 steps. I also will say that I think that our community has done a lot of work in the area of suicide prevention and access to care and reducing stigma associated with mental health over the last couple of years. And I think as a result of that work, what we see is we see a higher number of people reaching out for help. We see a larger number of people calling our crisis line. We see a larger number of people that we're doing crisis assessments on, that our community partners are doing crisis assessments on. And so these aren't necessarily bad things. They mean that we have been able to have an open dialogue about mental illness, about mental health conditions, and about how you access care. And so those are all good things. The last thing I'll say about that is there's also been a lot of discussion about deaths by suicide. And we have been concerned about the suicide rate in Johnson County for a number of years. Back in 2012 is when I first saw the numbers going up each year. And by 2016 and 2017, that's when we began to start to work with the schools. And in 2018 is when the school districts came together with the mental health center to create 0 Reasons Why. And it was at that point that we had really reached a high level of death by suicide, not only among young people, but within our population. And thankfully, in 2019, we saw a 20% decrease. And I think that was due to a lot of the work that we've done in our community. And despite the pandemic, while we're not going to be where we were in 2019, we're going to be about where we were. It's going to be a little bit higher, but it's still a significant decrease than it was in 2018 and 2017. That tells me that we as a community have done the things that we need to do. And again, I think it also goes to the fact that despite this pandemic, we have very resilient young people in very resilient communities. And so I think that's when I think about the mental health of our community, mental health is critical, and we should definitely focus on how we helped our loved ones process all their current experiences. And I think what we've done well is begin to pivot on how we can help them meet those needs in new and creative ways, despite all the challenges of the pandemic. So with that, I'm gonna stop for a second and see if there are any specific questions that you all have.
There are a couple. Let me read it out
Okay.
loud. How does a person keep their mind busy during these times of long periods of being alone?
I think that's difficult. But I think what is important to think about is that while we're alone, we don't need to be apart. And so being alone is a state of being. And that's actually something that we have control of. Now, it may not be that someone's going to be in the room visiting with us. It may not be that we can give someone a hug. But we can certainly, I know I'll give you an example. My wife was a part of a yoga studio, and she went there every morning of the world. And that was a very huge support system for her. And not only for the yoga, but for everything that happened up to they started doing yoga to everything in the lobby after yoga. And so at one point they just decided that, well, they're not doing yoga. The studio's closed, and it's been closed. That they were just going to get together for coffee via Zoom. So they are doing Zoom coffees, where they get together on Zoom and have a conversation and stay connected. But we really have to evaluate what we mean by how do we keep our minds busy during times of long periods of being alone. I think that we can also look to see what other options there are for us out there. I was listening to our podcast. We have a podcast called It's Okay If You're Not Okay. It's a pretty amazing podcast, actually. But I was listening to the podcast this morning on my way to work, and one of the staff here at the Mental Health Center were sharing that the pandemic, actually, she's very much an extrovert, so she's always out doing stuff, and that because of the pandemic, it forced her to stay inside, so she still had to figure out, she's basically focused on, okay, now that I'm in my house, what is it that I could be doing? And so she reconnected. She loved to put puzzles together, but never found time to do it. So she reconnected with doing the puzzles and redecorating her house and things like that. So I think that it's a challenge to do that. But again, I think we have to think about alone doesn't necessarily need to mean that we're apart, if that makes sense.
I think it makes a lot of sense, and sometimes easier said than done too, because I know that we don't want to bother other people, but one of the things that has become very apparent for me is that person that I'm thinking about probably is having the exact same feelings that I'm having.
And that is a good point, is in something that you said there, was we don't want to bother someone. The fact is that I think a lot of us are saying that. And the fact is we probably just need to go ahead and bother someone. If I call Judy and she really doesn't want to be bothered by me, she's going to tell me. But my guess is that in most situations, it's going to be welcomed, because we're all experiencing this. I mean, we're all in it. And I think that's how we're going to get through it is together. That's how we manage the stress, is for us to find a way to be apart, not alone, physically distanced, but socially connected.
Very well put. You know, what I'm finding personally is it seems to be catching up with me. You know, we started all of this in March, and we've been working hard and trying to stay adaptable and flexible. And all of a sudden this month, it just really hit hard. So I'm wondering, is that because it's holidays, or is it that time frame that it just really is starting to take its toll on people? Because I know as many people as I get the opportunity to talk to, I'm not the only one feeling this as well.
Right, and I think that's important for people to talk with one another about, because I think what you'll find is that it's fatigue. I mean, when you have to make major changes in your life and adapt, that's hard, number one. We're not necessarily, as adults, I'll say, we're not necessarily as adaptable. Kids are pretty adaptable, but as adults, we tend to like our structure, and I think that's another thing that we can do to help minimize the stress, is to find new ways to structure our time and structure our days. But we have reached that point of fatigue, and I think part of that has to do just by the length of time, but I think part of that also has to do with that there's a light at the end of the tunnel. And so when you begin to start to see the light, it's like, how quickly can I get there? So now we have this vaccine, and we hear about this, and so I think that is part of it. I think it's also really important for us to realize that it's not over. And so that while we're fatigued and we're tired, we need to probably right now more than ever reach out to one another and help support one another to get through this kind of final push.
Yep, agree completely, Tim. Here's another really good question, and it's, how does one cope with the constant negativity that's presented by the media, including social media?
Yeah, I think you unplug.
Yeah.
And a lot of people have done that. That is a lot harder said than done as well. But you know, I don't know if you haven't watched The Social Dilemma, which is an excellent program on Netflix. The fact is that social media in particular is geared to attract you and keep you connected. That's how they make their money. And so they make it addictive. And they make sure that you're not seeing a breadth of information, that you're seeing the information that they believe is what you want to see. And so I think one of the things that I think that I've started to do, in particular with social media, because I like to maintain a social media presence just because I like to get information about what's happening at the mental health center out there. But what I've done is made sure that I have not, that I follow everyone with every type of opinion. So I can imagine that those algorithms that are trying to say, okay, what is Tim DeWeese like, are really confused because they're sending me posts about everything. And so it's about, if you want to stay on social media, then I think you have to know how it operates. And that Social Dilemma would be I would encourage everybody to watch it. But then I also know a lot of people that have just said, I'm unplugging. You know, a lot of times handling that stress is just by simply not involving yourself with it and finding a different way to engage in the information that you get. There's also another group that I'll share with you. It's called START. And START stands for Stand Together and Rethink Technology. And it's actually was founded by two mothers in Blue Valley. It was actually, Diane Sawyer came here to Johnson County and did part of a big technology thing that was on 2020. And they really provide a lot of information to parents about how to manage that with their children. And you know, one of the things that I feel strongly about is that I think that that kids, and I've said this a couple of times, I don't believe that you know, when parents get their kids phones, it is up to them. But I would suggest that a kid doesn't need a smartphone until they're in middle school. And when I say smartphone, what I mean is they're dumb phones. There are phones that look just like smartphones, but you can't access the internet. You can't access social media. I liken it to like driving. When I turned 16, my dad didn't just say on my 16th birthday, here's the keys to the brand new car, go have fun. You know, I went through, I remember sitting in the driver's seat with him next to me, yelling at me about how bad I was doing and what I needed to do differently. And it was traumatic. But if you think about social media and, like, for example, smartphones, in a few days, there are going to be a number of young kids get a brand new box with a brand new smartphone, and they open it and they go off and take it. That smartphone is the portal to the whole world if it's not used in a proper format. And so just like driving, you have driver's ed. We need to have phone education for our kids so that we can begin to educate them about how to use technology. They can teach us how to use technology, but I'm talking about how to use technology in a thoughtful way, how to balance that tech life, real life balance. Because what we see on social media and what we experience in technology in many respects is not real life. And so we have to be able to manage and help our kids manage that real life. So START is a really good organization to get information from about how to balance that in that technology.
So how about this one? Do you think in today's society, less parents are having important conversations with their children in regards to drugs, handling stress, suicide, etc., compared to past generations?
Well, I think that I don't know that it's less than in past generations. I think the magnitude of the things that our kids are exposed to are way more than I was exposed to as a kid or kids before me were exposed to. And the best thing I can use is bullying. You know, I've always struggled with my weight, so I was a fat kid in school, and so I got teased and bullied for being the fat kid. But I got to go home from school and just play with the kids around my block. And on the weekends, I didn't have anything to do with school, so weekends were awesome. And the summers, even better. The problem today is that kids are connected 24 hours a day, 7 days a week, 365 days a year. And the bullying is very different today. They don't say, hey, you're the fat kid. They may say, hey, you're the fat kid, but after that, they'd say, and if I was you, I'd kill myself. And that's what's coming across on these devices. 24 hours a day, 7 days a week, 365 days a year. And so we have to be able to find a way to do that. I've also had kids that we've actually had to change the way that we do the questions that we ask when we do an assessment with a youngster around sleep. Because we'd say, are you sleeping well? And they say, oh yeah, I'm sleeping fine. But then when we start to engage them in the conversation, what we find out is that throughout the night, they're checking their phone and that they're responding to the dings and the notifications. But because they are asleep and they wake up and respond and then go back to sleep, they think they're sleeping well. Well, the fact is they're not sleeping well at all. They're not sleeping well at all. And so we see We see at schools when we have a lack of attention, we see kids falling asleep. The fact is that what kids are experiencing today as a youngster is much different. And I think it's very hard for parents to have those awkward conversations. So I won't necessarily say that they're not having the conversations less than before. What I will say is that parents need to have those conversations with their kids. Their kids are looking for it. When I asked, I was on a panel with a youngster, she was 16, and her and I were on a panel discussion, and we both got asked if there was one thing that we could say to parents to improve their kids' lives, what would it be? And the 16-year-old answered before I did, and she said, "Mom, Dad, put down the phone and listen to what I'm saying." And then I couldn't say anything else. We have to, and when I say have the conversation, honestly, a lot more of it is not about conversation. It's about listening. It's about open-ended questions and then hearing in a non-judgmental way what they're saying. And when I've worked with when I work with parents on this, what they find is that if they are less reactive, then their kids start to actually have more conversations with them. And so I don't know if it's about necessarily having a conversation. It's about asking questions and then listening in a non-reactive, non-judgmental way. And
Honestly, that was one of the first things that I think it was your point too, is about the reactive.
Yep.
Sarah Askren is saying that she has two really awesome, she didn't say that, I'm saying this, but she has two really awesome teenagers, and they're pretty resilient and they're doing really well during this time. But I know that she has families out there that aren't doing so well. So how can we connect to those people that aren't engaged?
I think that gets back to where I think it was number 4 about helping others and gratitude. I think this is where, and I think there is something going on right now because of the holiday season. I don't know if you guys have known it, but I see way more people decorating their houses, and there's more lights in neighborhoods than I've seen in previous years. And I think that's an expression that people are wanting to get together, and they're wanting to connect with other people. And so I think what we have to do is take a responsibility to outreach those folks. So if they have families, if you know of families that are maybe disconnected, find a way to try to connect with them. And I think if each one of us did that, that would go a long way. But I think that, again, I said this earlier, I think that we're at a really cool point in time. And what I mean by that is that I think there's an opportunity for us to come together as human beings, as communities, as neighborhoods, unlike we ever have. And I think if we did that, if we reached out for those families and those kids that are not feeling connected, then that would be how we do that. And so it could be as easy as calling someone, texting someone, leaving someone a personal note. One of the things that we started doing here at the Mental Health Center, because we have cards, we've been relying on snail mail more than we ever have. And it's simply, it's as simple as having a card that says, "I'm thinking about you, hope you're doing well, give me a call," and sending it. And so, sometimes taking a step back to our past, using snail mail, using a pencil and a note card can go a long way.
Absolutely agree. Those are the written out questions. Are there any others before we say thank you to Tim? You know, I will tell you that one of the words that I wrote down that I really want to focus on, Tim, is gratitude. I think it is a powerful word. And I know that it goes a long ways with me because they say that by giving a compliment, it really makes that other person feel good, but it makes you feel good too.
Yep.
So I am so appreciative of all the words that you've given us today. Any last comments?
You know, I might just share one more thing as we wrap up, and then one of the things about the gratitude, I've heard a lot of people talking about, oh, thank goodness 2020 is going to be over. And while I understand that premise, I would challenge everyone to look at the opportunities that came about as a result of 2020. And I can share with you one for me. My mom fell and broke her hip. And I didn't, because of the pandemic, we didn't even think twice about having her go to a rehab, which is where they wanted her to go. But fortunately, me and my sisters were able to switch it up and spend time with her weeks at a time. I have never spent a week with my mom as an adult. And that was a whole new experience that I would have never had. And something that I value looking back on it more than anything else this year. And that would have not have happened if it wasn't for 2020. And so I think that when we also talk about gratitude, I think we also have to think, you know, this year's coming to an end. I hope the pandemic, I feel pretty confident that pandemic's coming to an end. But it wasn't all bad. And so if each of us can look back and say, you know, what was that positive? What is it that I'm grateful for 2020? I think that would go a long way in helping us move forward as well.
Wow. I think we have one more question.
Yeah.
There is one about, can you tell us about dealing with grief?
Yeah, I mean, grief, you know, a lot of times people talked about that there was this cycle of grief, that you go through this cycle of grief. And I was trained that there's this cycle of grief, but the more and more that I've learned, I don't know that there's a cycle of grief. I think that all of us just grieve in our own ways. I think at one minute we can be mad. At one minute we can be sad. We can be angry. We can be blaming. And you know what? It's all okay. It's okay. Because grief is real. And each one of us are going to experience it different. Where I think the most important thing is that when the grief does not relent, that's when you need to reach out for help from someone else. Because grief is normal and it's hard. There's no right or wrong to it. But when it becomes all-consuming, I think that's when you have to reach out for help. And so the best thing that I can say about dealing with grief is there's no playbook. And if one day you're sad and the next day you're angry and the next day you're sad again, it doesn't matter. Grief is grief, and we're all going to experience it differently. But when it gets to a point where it's consumed you, then you need to ask for help. And I think it also is good to talk with someone close to you about your grief, what you're experiencing. And I think if you do those two things, then that's the best way to overcome and deal with grief.
Tim, you're a very wise man, and we are very fortunate that you joined us today, because I know each and every one of us, I've been watching faces, And I know each and every one of us found a lot of comfort in your words and your wisdom. So as always, we appreciate you so much. Keep up the good work.
Thank you. And I
happy
appreciate everybody
holidays.
supporting the mental health center in our community like they do. The businesses have been wonderful, and the community is just very supportive. I'm very fortunate to lead a mental health center in a community that understands the importance of mental health. So thank you all for understanding that. And thank you for inviting me to speak to you all. I appreciate it.
We posted the toolbox, and then we're going to put that out in social media. Even if we need to unconnect from a little bit of it, it's still a good tool to get some
Perfect.
information out there.
All
So
right.
we're gonna talk about that toolbox, and hopefully everybody can get some good out of that too. Happy holidays, everyone.
Thank
you
you.
for joining us today.
All right.
Hey,
Bye-bye.
Tim, say hi to Debbie for